How much influence does Big Pharma have over the national media in the United States?
The influence of big pharma, the pharmaceutical industry, over national media in the United States is often considered substantial. This influence stems primarily from the industry's immense financial resources, its role as a major advertiser, and its ability to shape public discourse. Here's a breakdown of how this influence manifests. 1. Financial leverage through advertising. Major advertiser. Pharmaceutical companies are among the top advertisers in the U.S. media landscape. According to reports, the industry spends billions annually on direct-to-consumer DTC advertising for prescription drugs. In 2022, for instance, pharma companies spent over $6 billion on TV ads alone. Conflict of interest. Media outlets rely heavily on this advertising revenue, which may create a conflict of interest. Criticism or investigative reporting on big pharma's practices might be softened or avoided to maintain relationships with advertisers. Shop 2. Shaping public perception. DTC advertising influence. The US is one of only 2 countries, alongside New Zealand, that allow DTC prescription drug ads. These ads often frame health solutions as dependent on pharmaceuticals, influencing public perceptions and encouraging patients to request specific medications from doctors. Sponsored content. Big Pharma sometimes funds informative health segments or articles, which may subtly promote their products while appearing neutral. 3. Lobbying and partnerships. Industry ties to media companies. Pharmaceutical companies often have partnerships with media outlets or their parent companies, further complicating impartial reporting. Media companies that own healthcare subsidiaries or receive funding from pharma might have vested interests in favorable coverage. Political lobbying. Influence. Big Pharma spends billions lobbying Congress and regulatory bodies. This political influence can extend indirectly to media, as journalists may face pressure to align with broader political narratives shaped by industry lobbying. Suppression of critical coverage. Avoidance of negative stories. Critics argue that media outlets rarely investigate or highlight controversies such as inflated drug prices, unethical marketing practices, or lawsuits against pharmaceutical companies. Limited coverage of alternatives. Media might underreport on non-pharmaceutical treatments, preventative care, or critiques of over-medication, as these narratives don't align with pharma-driven advertising. Influence on health journalism. Funding of medical education and journalism. Some pharmaceutical companies sponsor health journalism initiatives or training programs, which may subtly bias reporting toward industry perspectives. Access control. Journalists covering the pharmaceutical industry often depend on access to company spokespeople, studies, or events. This dependency can lead to self-censorship or less critical reporting. Real-world examples. 1. Opioid crisis reporting. Some critics argue that media outlets were slow to investigate pharmaceutical companies' roles in the opioid epidemic due to industry influence. 2. COVID-19 vaccines. While vaccines are a public health success, critics point to the minimal coverage of pricing debates or intellectual property issues as examples of big pharma's sway over the narrative. Editorial independence. Many journalists and outlets strive to maintain independence and report critically on pharmaceutical companies despite advertising relationships. Regulation and scrutiny. The FDA regulates DTC advertising, and independent watchdogs often expose unethical practices, which media sometimes amplifies. What can be done? Media literacy. Audiences should critically evaluate health-related news and advertisements. Transparency in media. Outlets should disclose potential conflicts of interest related to advertising or sponsorships. Support independent journalism. Independent or nonprofit media organizations are less reliant on advertising revenue, which can reduce bias. The extent of Big Pharma's influence is significant but not absolute, as investigative journalism and public accountability can still challenge its power.